started. So I want to thank all of you for attending session 3, day 3 of our public health conference entitled COVID-19 and Beyond, Unmasking Inequities, Injustices, and Inefficacies in Public Health. Today, the focus will be on opportunities to shine, internship and career opportunities in public health. So just a quick overview of what we're going to be discussing tonight. So we're going to go over some tips for professional networking in public health. And then there'll be a video presentation by Sarah Welch, who is recruiting for a position or a couple of positions at Northwestern University's Feinberg School of Medicine. The next presentation would be by Dr. Maimunat Alex Ajumi, who is representing the American Academy of Pediatrics. And then finally, we will have an Internship Basics video that we will be showing at the end of the night. So first off, let's discuss the types of professional networks in public health. So the Harvard Business Review has 3 types of professional networks that they state exist and are important for public health professionals to have. The first is an operational network. So operational networks usually consist of internal contact within an organization. So within your own organization, that could really be anyone. For example, I work with a physical therapy company in the Chicagoland area. So some of my internal contacts could be someone from the billing department that specializes in working with attorneys or specializes in working with specific insurances or auto insurances, so on and so forth. So operational networks usually are there to help enhance a group's functionality as well as the efficiency of the group to make sure that everything runs smoothly. Another type of professional network that is important in public health is personal networks. So these are contacts who are from external locations. They might not necessarily work within the same organization that you are in. They might be in an organization that you aspire to be a part of. So these networks exist for professional as well as personal development, as well as to provide access for useful contacts. And then the final network is the strategic network. So this is comprised of internal as well as external connections that are looking to face future challenges, determine the priorities, and building industry support. So this is considered the most important in the field just because it is encouraging professionals to collaborate for a larger common goal, which as public health professionals, the common goal is to promote human health. So a couple of tips for networking in public health. The first is to be yourself. So the advice that seems pretty simple, but honestly still applies. A lot of successful professional networking just requires you to have a genuine interest in what you're pursuing as well as action. So they want to see who you really are, not who you are trying to be. And that's how you're going to be able to make that personal connection with whatever company that you are interested in. So you're not really trying to sell yourself. You're really thinking about making a personal connection with professional colleagues. So focus on who you are, just not what you do at work. The next thing is to be prepared. Being prepared involves researching the companies you're interested in or the organizations that you are desiring to be a part of. If you are in an in-person event, try and share a business card and ask if they want to stay in touch with you. And also they recommend having like a 30-second elevator pitch. So what is your why? Why are you interested in public health and why are you interested in the issues that you are desiring to pursue? Another tip for networking in public health is to listen and ask questions. So be curious. Ask people about themselves, about their work, and then make sure that you are hearing out their answer to have a full understanding of who they are as a person and also the work that they do. Another tip is smile, be friendly, be approachable, show that you're happy to meet them, show that you you just are enjoying the opportunity to speak with them. Smiling can go a long way. And then the last tip is don't do it alone. So one of the things that we want for you guys for this conference is to make sure that you're able to make the connections here so that you're also able to take that outside of here. So let's say you are thinking about going to a conference. We would love for you guys to connect with each other and just mention, hey, I'm going to this conference. Do you want to join me? You can kind of bounce ideas off of each other to kind of understand what you can do to be a better networker. Benedictine has a ton of resources for public health internships as well as careers. Our ACE Center has a wide array of opportunities and resources for MPH students, as well as alumni to use during their internship and career search. So one of the resources they have is Career Connect. So this is a site that allows you to connect with employers. You can post your resume and also create job alerts. So it's a little similar to LinkedIn, but specifically for Benedictine University. They also have resume and cover letter writing assistance. A couple of weeks ago, we actually had a workshop regarding cover letters and resumes. So if anyone is actually interested in receiving the recording for that, as well as the materials for that, we'll have a poll at the end of the presentation today that we'll be able to share with you so you can get that information. Another resource is interviewing prep. So kind of learning the basics of interviewing, see what questions will be thrown at you and help you to understand how it's going to feel when you're in the interview so that you don't feel as nervous. And there are also networking opportunities. So the Benedictine University Network via Wiser is another networking opportunity that you can utilize. Also similar to LinkedIn, you just have to create a profile and then you'll be able to network with other professionals within the public health sphere. And then there are also a lot of career programs as well as events that you can attend throughout the year. I know for this week, I know yesterday they had a session with federal programs that people could apply to. And then I believe there's another session tomorrow afternoon that people can attend. So be on the lookout for when emails come out because they're send a lot of opportunities that you can get involved in. So a video that we wanted to share with you guys that we felt would be very helpful is how to network effectively on LinkedIn. I know that is one thing that I struggle with a lot. So we just want to share this so that you can kind of learn how to cold message as well as build connections with people on LinkedIn.
If you're applying to a job online and that's the only thing you do, the chances of being discovered are probably really low. Hey, I'm Markel, and today I want to talk about networking and really seeking opportunities through LinkedIn or any other platform of the like. I feel like it's really taboo oftentimes to talk about this. The idea that, hey, I'm looking for a new opportunity, or hey, I'm a student and I'm trying to find an internship. You probably don't know how to go about it, or if you do, it was like some inside information that a couple people share with you like along the way. And today I want to share some tips and insights that will hopefully increase the probability of you finding your dream job or dream position and really being in position to present yourself, assuming that you've prepared accordingly. Number 0, apply online. I think that a lot of times people think that they can just like get away with not applying to a job if they can network their way in. That may be true in some cases, but I feel that it's still imperative, and I've talked to recruiters and I think that they think it's imperative to still apply online because that puts you in the system, that gives you the visibility. And so even though the probability may be low, especially if you're like a stack of virtual resumes inside of some database, it's still, you're in the system and then they can pull your information and then relay it accordingly. If you don't do that and you try to just send your resume through LinkedIn or you send your resume through an email that you may get, it may not actually get to the right people. It may not actually be seen. So Number 0, apply online. Number 1, find the right recruiter. And so I'm very intentional when I say right recruiter because you can find the wrong recruiter very easily. So what makes a wrong recruiter is if they don't care. Yeah, that's pretty much it. And if they don't respond, and if they just overall are not interested in helping you progress or helping you find that role that interests you. The right recruiter may not be the one that's going to be connected directly to the hiring manager, but it may be a person who can look at your resume, pass your information along, or give you that additional step or guidance in order to get towards the goal of getting a position or getting the visibility of getting the position. In order to find the right recruiter, I think it's being very intentional on how you reach out to them. Oftentimes people reach out and they kind of spam a bunch of recruiters or a bunch of people with a very generic, very long message. I don't think that's effective. And if anything, I think it reduces the probability of being seen or being taken into consideration by that individual. For example, I'm not a recruiter, but I've been reached out by students many a time, and I have a lot of messages that I don't typically respond to. Those include, hi, just hi by itself. How are you? Again, just by itself. Or tell me about how it is working at Tesla, or what do you enjoy about Tesla, or tell me about Tesla, or give me information about it. And I don't answer that one probably because it's just such a long-winded answer. I don't even know where to start. It's too open-ended and just like, it's nice, right? That's kind of what I would say if I do respond. Like, it's just like a positive sentiment. It's like, yeah, it's pretty cool, right? It's like, I don't know where you're going or where you want to go with that question. And then lastly, a common message or a message type that I get is a very long autobiography. And I'm probably not gonna read it. I try to read as many messages as I can. I really wanna help students out, but a lot of times, like, if it's too long, if I don't have the time or the energy to read it, it just doesn't get read. So be mindful of when you're reaching out. Like, if it's not a recruiter, you may wanna scale back on how you're approaching them. When you get the right recruiter, the key thing is to try to keep the ball rolling. So you reach out to them, you are able to build a relationship or develop some rapport, and the goal of that interaction is not to get an internship or get a job off the bat. It's to develop and build a bridge or connection, your network. So build that connection in order to hopefully get insight on how you can improve your resume or something else actionable like that. So the best way I would go about it is being able to ask for something big and something small. So I have a template message that I will read, and I guess I'll put it on the screen while I read it. So you can see and kind of use that when you're reaching out to either a recruiter or maybe an advocate, which I'll get to in a second. Hi, insert person's name here. I'm such and such, and I have an interest and experience with this. I saw this job, link here, online, and wanted to see if you would be able to connect me with someone in that department or share a tip to gain visibility to increase my odds. I would be excellent because this. Thank you, your name here. I think what's really good about this message is it gets to the point, it asks for two things, something big and something small. I think asking for something and being very specific will help you because they can say, I can do this big thing, whether the big thing is connecting you with the person, speaking with you on the phone, or whether it's something small like providing a small tip or a piece of insight so you can start to inch your way towards that goal of being in a position to really interview for an opportunity. So that brings me to number 2. It's finding an advocate. So the difference between a recruiter and an advocate is that a recruiter is actually the person that relays your information to the hiring manager. They do that initial screening. So an advocate, their position is completely independent or often independent of the actual recruiting process. They may be someone at the company or near or within a network that can either impart knowledge or connect you to the right people. So really their job or position will be to advocate for you in order to get the exposure or the visibility to the hiring managers or the recruiters. So like I said earlier, the tip on reaching out to a recruiter, that applies here as well. If you reach out to a potential advocate, again, they don't have to be a recruiter, and you say that message that I mentioned, look, I'll throw it up again. So this message, hi, such and such, I'm blah, blah, blah. that message will, I think, take you a long way because it's very direct. It can start a relationship, it can start a conversation, and that's really what you're trying to get to. You're trying to start a conversation. And if you can get to a conversation, I think that the odds will increase from there. And the last thing I want to talk about, number 3, I think people are sleeping on this, is creating content. If you're on LinkedIn and you are a graphic designer, if you share through a series of posts or a series of articles or a series of videos, things that you've created, projects that you've worked on, and you kind of showcase it like real time or live or like on people's feed, that creates exposure. And as someone who like loves seeing people creating things, I'll definitely like it, I'll definitely reply, or other people will engage with it. And what that will do is create your online presence and really extend your presence beyond that of just a dormant, stagnant, kind of stationary LinkedIn profile. And again, nothing wrong with a LinkedIn profile. I shout out to it. I got a job because of it. I think that so much more can happen once you start creating something depending on your industry. So if you're an engineer, have your projects able to present. Write an article about a tough problem that you solved, and that will show your technical competence in the best way. It's better than trying to like highlight it in 3 bullet points within your resume. So think about that one. I think it's a little out of people's comfort zones, but I think if you do it, you'll have positive results. And the probability will only increase from there. And the last thing I'll say is all of these things can all be done in parallel, right? So the probabilities are not necessarily additive, but they do accumulate in the sense of it only makes your chances better. So if you apply online, reach out to recruiters, try to find an advocate and create content, the probability of you finding your position will be the highest because you're doing as many things as you can do in order to position yourself for the opportunity. All right, so that's all I have for this topic, and I hope that adds value and gives you something to think about, but also something to do. So let me know in the comments how you reach out to recruiters or how you engage and the successes or failures that you've had. Really be interested to learn a little bit more about that. And if you're interested in seeing more content like this, feel free to subscribe, like this, and I'll be making more, so stay tuned, and I'll see you on the next one. Peace.
So I hope that that video was helpful for everyone. I know that it really challenged me, especially his third point about creating content, because usually I don't really do that much on LinkedIn, but even at yesterday's session with the alumni, a lot of them talked about either making meaningful posts or commenting on a post just to kind of increase your visibility on LinkedIn. Okay, so we are going to move into our first video presentation regarding internship and job opportunities. So Sarah Welch is the Director of Evaluation Research in the Buehler Center for Health Policy and Economics. Sarah and her team provide high quality, state-of-the-art evaluation services to Northwestern faculty, staff, and community organizations working on public health research, policy, and programming efforts. The goal of her program is to support the evaluation of these efforts and promote the use of data for decision-making to strengthen these efforts and their ability to improve and protect health in Chicago and beyond. So she was not able to join us virtually today, so she did record a video for you guys giving a little bit of information about the opportunities that she has, as well as some tips that she had in the internship and job search.
Hi, my name is Sarah Welch. I'm the Director of Research Evaluation in the Buehler Center for Health Policy and Economics, which is in the Feinberg School of Medicine at Northwestern University. I want to talk with you today about 2 things. One, I'm going to tell you my sort of advice about looking for internships and sort of just my thoughts on that based on my experience, and then talk to you about a new project that is starting this summer in the Bueller Center and some employment opportunities that are associated with that you might be interested in. So my internship advice is to not necessarily only look for internships in the field or the specific topic area or skill set that you think you're really good at. The example with me is that when I was earning my MPH, I did not focus on evaluation. I thought I was going to go into health promotion and health education. But when I graduated, I saw an internship for evaluation, and I thought, well, I'm not actually that strong in evaluation. I should probably maybe go try out this internship, beef up my skills a little bit, and then be, a more well-rounded candidate for future employment. So I did that. And then surprise, it turned out I actually was very good at it. I thought it was interesting. It was a good match for my skills. And then it did turn into a permanent position that I then had for about 12 or 13 years until I transitioned to my new position at Northwestern. So that's my advice, is to keep an open mind and think about, certainly if, feel free to look in areas that you're good at or you feel that you're strong, always play to your strengths is not bad advice. But I think being open to trying new things, especially during an internship when you're really building your skill set, I think can be a really powerful tool to make you a more marketable and well-rounded candidate in the future. And actually, you might uncover some hidden passion that you didn't know you had. So that's my advice about internships. I want to share with you some information about a project that's starting this summer. It is a project that is using sensor-based machine learning algorithms to measure toddler physical activity. So what that means is we are using accelerometers to measure toddler physical activity. So toddlers age 12 to 36 months. And we're going to be doing this 5-year project looking every 6 months at toddler physical activity and toddler and mother behaviors around physical activity as well. The goal of this project is to link the measurement of toddler physical activity with the activities that they're doing and validate the accelerometer metrics and sort of the algorithm cut points, which is sort of the spots at which the measures distinguish between like moderate physical activity or vigorous physical activity. And so what we're going to be doing is surveys with mothers about their activities and their toddlers' physical activity and development. And it is a longitudinal study that we will follow the toddlers from age 12 until 36 months. It will be rolling admission, so the whole project is 5 years, but the individual kids and their mothers won't be enrolled for the whole time. And what we're going to be doing, what we're looking for is a research study coordinator, as well as 2 research study assistants to do the data collection and the data storage and management for this project. So what that means is enrolling participants into the study, scheduling and coordinating the data collection. So that means doing the assessments, observations of the mothers and children, the surveys with the mothers, and then there will also be some coding of video observations of the toddlers as well. And so what we're really looking for in this position, or sort of all 3 of these positions, they vary slightly, but generally do a lot of the same things, is we're really looking for someone who is organized. I think this will probably go for any clinical research professional position or any social behavioral research professional position, is that when you're doing data collection, you're scheduling it, you need to make sure that you are there when the participant is there. Otherwise, it's a pretty bad look. So you do need to, be able to keep track of schedules, your schedule, your team's schedule, make sure that there's coverage for data collection. And so that's sort of on the front end, being organized around collecting the data, but then also you really need to be organized and have good data management skills around how you store the data, making sure everything is filed where it needs to be filed, everything is labeled how it needs to be labeled, all the paperwork, and it's not really paper anymore, all the electronic work is organized in such a way that you can find it again. So really organization is kind of the key thing for me when I'm looking for someone for these types of positions. The second thing is, and it goes, I hinted at it a bit, is dependability. I can't overstate this, that especially when you're trying to build trust with your study participants and you don't want to be wasting their time, being dependable so that you are where you need to be to collect the data is really important. You need to be respectful to the people who are giving you their time to participate in the study. And then the last one is sort of I'm smushing together. They might be two separate skills, but I'm going to pretend that they're one, which is sort of someone who has good problem solving skills and the initiative to think through how we're doing things and identify whether there's a better way to do it. So with any research study, there is, a research plan or a protocol that you are following. And so it is very important that that people in these positions can follow the rules. With research, as you well know by this point, you need to do the same thing in the same way every single time. And so we're not looking for deviations from the research plan. However, there's sort of this counterbalance where we're really looking for someone who can follow a protocol, follow a research plan, to the letter, but also keep an eye out for ways to improve, communication with participants, or ways that, as you do data collection, you see an opportunity to strengthen retention by, doing this, that, or the other. So this balance of being able to carry out the study activities as designed, but keep an eye out for ways to improve communication or retention, as well as being able to be quick on your feet when there are problems. There are always things that come up when you are working with other human beings on research studies, any human subjects project where you are interacting, collecting data, scheduling, things are going to happen. And so being able to understand the project and then, apply really strong problem solving and critical thinking skills is really important. Then all of the other things that people are always looking for. This is a team project. There will be multiple people doing data collection. I will be working on the project. There will be the other team members. So being able to work as part of a team, carry your part of the project and be responsible for that, but also help out others, as people need support as well. So those are sort of the major tasks and activities. A little bit more about the project. It is a 5-year funded project. And the 2 positions are full-time, and then 1 position is part-time. The full-time positions will be mostly in the field doing data collection. The field will be a play space in Skokie and a play space in Bucktown in Chicago. The rest of the time will be mostly at home or wherever you do or have been doing your remote work. We will likely have people come into the office on the Chicago campus of Northwestern every now and then, but for the most part, this will be a hybrid leaning towards fully remote work situation, understanding that much of this will be out in the field doing data collection as well, but then you'll go back and your home base will be your home. In terms of hours, it is daytime hours, but they're, during the week. But we are looking for some flexibility if a mother requests a Saturday appointment, that there is some flexibility to do Saturday appointments, though not always working Saturdays all day. It would be sort of just as requested by the mother. I think that's sort of those are the main highlights of the position. I think taking the focus back out a little bit, I think as a career path, working on research studies, both either clinical research studies or social behavioral research studies, is a really interesting and fulfilling way to use your MPH. I have focused on evaluation. And so I've worked on the evaluation piece of many tens of almost 100 research studies. That's probably not true, probably 50 research studies over the course of my career. And it's what I love about it is that I get to see all different ways of applying different strategies to improve health. And so the topic changes, but the end goal of strengthening the health of families, and I have focused mostly on children and families in my career, but strengthening families and children and adults, their health in Chicago is sort of the ultimate goal. But I get to see it done in all sorts of different ways, from health education programs around diabetes prevention to vaccination efforts to violence prevention efforts. It is really very interesting to be able to learn about all these different fields while still applying the skills that I have and working towards, my ultimate public health goal and interest. So thank you. Hopefully I will hear from some of you if the research study position sounds good to you. Have a great day. Bye.
Okay, so that was the presentation from Sarah Welch. Here is her information. At the end of the presentation today, like I mentioned earlier, we will have a poll that we'll be posting in the chat if you have any interest in the positions that she had described. I am going to move on to the next presentation, which was by Dr. Alex Ajumi. So she is a physician and global healthcare professional with over 16 years experience in program management, healthcare service delivery, health system strengthening, knowledge, and people management. She's trained and worked in sub-Saharan Africa, the United Kingdom, as well as the United States, where her key focus areas were designing and developing and integrating standardized programs, systems, and teams to promote health equity, improve quality in clinical services, and strengthen healthcare systems. Maimuna is passionate about maternal and child health and health workforce training. This passion, coupled with her expertise and years of experience, have seen her work to improve health indices, build capacity of health workers, and strengthen health systems in over 40 plus countries across 5 continents. Like Sarah, she wasn't able to be here with us virtually, but she did record a video with me that was kind of more of like a conversational interview. I will mention that there is an old school GameCube in the background, so just pardon that because the room that I was using, that was the only one available. Hello, everyone. I want to thank you for joining Benedictine's Public Health Student Organization's Internship and Career Q&A session with Dr. Maimuna Alex Ajumi. I just want to thank you so much for joining me today in order to talk about this with our students and alumni. But before we get started, I just wanted to ask you to share a little bit about yourself with our students and alumni.
Thank you so much, Karen, and thank you to you and your team for the kind invitation. So as a way of introduction, my name is Maimuna Alex Ajumi, as you said. I'm a primary care physician by training, as well as a global health practitioner. I'm currently the Director of Global Training and Implementation at the American Academy of Pediatrics. Prior to this, a lot of my work in global health has been focused on providing healthcare service to underserved communities And then also supporting a lot of healthcare worker, supporting and actually implementing a lot of healthcare worker training programs in resource limited settings and supporting health system strengthening efforts. I'm glad to be part of this.
Okay, thank you so much for sharing about yourself. So the first question that we had for you are, what are the top 3 qualities you look for in a candidate that you are interviewing for a position?
Yeah, that's a great question. And in terms of qualities, I think ultimately, depending on the exact position and the role, we want to ensure that there is the right fit, the accompanying technical skills. So let's say it's a project management based role. So we'll be looking for candidates that have skills in project management as well as program coordination. But then overarching skills that we also look for is experience and expertise in global health, especially living and working, even if it's in a volunteer capacity in a resource limited setting, just because that's the core of where our programs are. And then also cultural competency, just cultural sensitivity and awareness, just because we work with a lot of global stakeholders. So somebody who is able to work with a diverse stakeholder base is somebody who will do well on our team or with any of the roles that we typically post. Of course, we add all the other skill set that you would expect, creative problem solving, ability to work independently and also as part of a team, and then also managing work with different timelines or maybe sometimes conflicting timelines. But I would say, if I would say the top 3 is technical skills related to the role, experience and expertise in global health and public health, and then as well cultural competency and awareness.
Okay, awesome. What do you like the most about working for your organization?
So the American Academy of Pediatrics, despite the name American, is actually committed to caring for the health of all children. And in our mission and vision statement, you would actually see it where we work to obtain optimal health, and it's not just physical health, but mental, social health, as well as well-being for all infants, young children, adolescents around the world. So for me, that mission closely aligns with my own life purpose and goals, where as a physician and a global health practitioner, my work is really centered on caring for the for health populations, especially health populations in underserved communities. So that's why I love the work I do.
Okay, cool. What would you tell a student who's looking for an internship? So what advice would you give to them?
That's another great question, because we do have a lot of internship requests. I would say not just from the AAP standpoint, but generally in global public health. Look for organizations that their mission, their vision, and their values align with your own life goals as well, because each organization has their culture, their portfolio, their way of doing stuff. Secondly, I would say be very creative with how you present your skill set and what you bring to the team. So a lot of organizations, even though they might have internship programs, are usually also a way to see how you work well with teammates, how you bring value to the team, and how you contribute to the work that is done. So for interns, because I do review a lot of applications, that some are great, some maybe need some work, really depending on where the intern is really work on presenting yourself as somebody who aligns with the interests of the organization, will bring value to the team, and also showcase how that internship opportunity or experience is going to tie in with your own personal and professional goals, both short-term, medium-term, and long-term, and that you're not just checking a box maybe to fulfill a practical.
Okay. You mentioned that you've reviewed many applications. What have you noticed about the applications that were stronger that drew you to them?
The applications were just reading. I could picture who the intern was, what they would bring to the table, and what their medium to long-term goals were. And that again is really in how your cover letter is drafted, because there's only a limit to what your resume can say. So the accompanying cover letter also gives you a snapshot, gives your interviewer or the hiring person a snapshot as to who you are, or at least gives them a window into who you are as a person and professionally as well. And you'll be amazed that you get to see quite a bit of typos with applications. So this might be basic, or this might be something that is known, but read your applications very, very well. And then lastly, even though it's an internship, depending on the organization you apply to, there's what we call ATS, the applicant tracking software. So when you're applying for an internship position, review the job description really well and make sure that your resume and cover letters capture a lot of those keywords, like we call them. So if the position has a heavy focus on program management, make sure that you're tailoring your resume, especially the summary portion of your resume, as well as your cover letter, highlighting any program management skills you have, even if it's in a volunteer capacity. Yeah, so those are the things that really stand out from just my application review experience.
Okay, all right. And then one last question for you is, what kind of roles do public health professionals have at your agency or your organization? Mm-hmm. And then what kind of experience do you seek for those roles?
Yeah, so I work under the Global Child Health and Life Support team at the AAP. So our section and our department is really focused on global health work. So a lot of the people that work on my team and several other teams under the global umbrella have MPHs and experience in public health. We have quite a few people who have been Peace Corps volunteers before, or have lived and worked in resource limited settings in sub-Saharan Africa, Asia, Middle East, like I have as well. So a lot of the skill sets that we all bring is because we implement a lot of projects, so program management and coordination skills. We focus on a lot of grant writing and grant management. So the ability to not only write and review grants as part of a larger team, but also able to manage grants is a highly sought out skill. And then working in teams, or being working across different stakeholder groups and working to ensure that those groups are collaborating is another highly sought out skill set for the team.
Okay. What would you say to someone who doesn't have kind of a foothold in public health quite yet? What advice would you give to them when they're, because I know for me personally, sometimes I get worried, like, do I have enough experience for these internships and careers that I want to get? What advice would you give to those of us?
Yeah, that definitely, I was in that boat several years ago, is continue to look for that one opportunity whereby you get to cut your teeth or sink your teeth into public health or global health. I would also say be very intentional about the experiences and endeavors you engage in. Doesn't mean you won't engage in other stuff, but for instance, public health, there might be some opportunity to engage in some public health type role on campus, even as a student. And then that would also account for some of your public health experience. I would also say people who tend to volunteer as, either data collectors. One thing I also want to mention in terms of skill set is we do a lot of, in addition to program implementation, we do a lot of monitoring and evaluation. So data collection, analysis, and reporting skill set is also highly valued on the team. Now the perfect segue to that point as to, what people should do is any capacity you can volunteer in the community, either being your school, your academic community, or your much broader community, in terms of, supporting data collection efforts, supporting program implementation efforts, speaking with beneficiaries of projects is highly valuable, because one, you gain confidence and experience utilizing those skill sets, and those are the things that you can demonstrate when you apply into your first professional position.
Okay. So what other skills, what other ways can people take action in order to build their skills in public health or healthcare in general?
So certainly we keep talking about mentorship coaching and having like support systems within the field professionally and especially in public health. So I would say, people who are looking to build careers in public and global health should actively seek mentorship and coaches in the field. There are different ways of seeking mentorships. A lot of graduate programs, both undergrad and graduate programs, provide mentorship programs, and I would say sign up for those. In terms of personally and professionally, utilize social media platforms as well as online resources to try to connect with people. LinkedIn is that professional network, and I've used it many times. I've been able to connect with mentors, mentees have been able to connect with me, and that's one way to really optimize your profile. Look at profiles of people who have done work in the field that you want to do, request to follow them, send emails, in-mails within LinkedIn, and you'll be amazed at some responses that you get, and people are actually eager and willing to connect with people, as well as Twitter. And a lot of organizations also have active fellowship or mentorship programs for people seeking to build careers in global health. So I would say people who are also open to starting their careers might want to do some fellowships first before applying to positions or in between, because that also helps provide a lot of mentorship and coaching in the field of global and public health. Some examples of fellowships I can think of are Global Health Corps. I was actually a part of the Global Health Corps fellowship program over a decade ago. You have Atlas Corps. I mentioned Peace Corps. Also like Acumen fellowship programs. There are a ton of resources out there of a lot of these fellowship and mentorship programs. And then I would also say, if you have an opportunity either via your institution or some of these fellowship programs to travel abroad, is to optimize your time in country to identify stakeholders and projects and organizations that you're interested in their work and are willing to have you shadow them or support their project even in a volunteer capacity. One, that helps you build your professional network, which is very important in global health or any professional realm. And then it also helps provide some hands-on field experience, which is a highly sought after experience or skill set when you are applying to global and public health jobs. And again, like I said, just reaching out to different groups and individuals on LinkedIn, on Twitter, follow them, understand their work, and in turn, actively build your profile on those platforms as well. Share your interests, share, what you're doing as a volunteer, and also, even within your capacity as an intern or as a student as well.
Okay. All right. Thank you so much. That was perfect.
Yeah. And I'd mentioned I work with the American Academy of Pediatrics. So for anyone interested in any of our both internship and full-time opportunities, please go to www.aap.org and search under the careers section.
All right. And we'll also be sharing Dr. Alex Ajumi's information as well. Some of you may have seen her on Monday for her presentation, so you might have gotten her information then, but we also will provide it afterwards. Okay. Thank you so much. We really appreciate you coming by and sharing your wisdom with us. I know that I've gained a lot from it, and I'm sure that our students and alumni will as well. So I just want to thank you again.
Thank you, Karen, and thank you to the team for having me.
Okay, so here is Dr. Alex Ajumi's information once again, if you're interested in contacting her. As I mentioned before, we will be conducting a poll, so if you are interested in any opportunities with the American Association of Pediatrics, you can mark that on the poll that we will post in the chat. But we are going to move on to the Internship Basics video. Just to kind of share a little bit about the MPH internship process at Benedictine.
Hello, welcome to this presentation. We will be covering some basic information about setting up your MPH internship. As you know, you'll be required to do a 240-hour internship, and this will hopefully get you started on the right path. During this presentation, you will learn the purpose of the internship, get some tips on the search process, learn about the pre-internship planning requirements, and receive some contact information. The purpose of your internship is to gain real-life, real-world experience and apply all of the knowledge and skills you've gained from your other courses throughout the program into a real organization to solve problems and help advance their mission. The benefit to you, in addition to gaining the 240 hours of experience, is that you'll also be able to network with individuals on different teams and in different areas of public health, and you can also gain references that you can use later as you're job hunting or building up your professional resume. You will also be developing some work products that you can put into your professional portfolio and share with prospective employers down the road. Your responsibility as you start the internship process is you'll need to, once you secure your internship, submit some documentation for faculty review, and we'll talk about that a little bit later. You'll need to meet the deadlines that are provided to you, and you'll need to be in constant communication with Cara Watts, the internship coordinator, and Mary Spengler, the program coordinator, as well as your internship instructor when you're actually doing your internship. You will be required to have a preceptor. The preceptor will be your mentor. They'll need to sign off on your internship plan prior to starting your internship. They will supervise you and mentor you throughout your internship and sign off on your time logs to make sure that you're tracking hours appropriately. And they will also submit a final evaluation of your performance after you've completed your 240 hours. We expect that they will be qualified, and we'll talk about that in a little bit. The first step to finding an internship is starting locally and globally for a search. Locally can be one of two things. The first is area hospitals, nonprofit organizations, public service organizations, organizations that serve specific populations. A great place to start is your local health department and maybe a local hospital center. Most bigger hospitals have a public health department, so contacting them to start would be a great way to go. You can also kind of think outside the box. There's a lot of healthcare associations for doctors and nurses and other healthcare workers, insurance companies. You can also consider possibly doing a public policy internship with a congressman or a local representative. You can also consider internships with school districts or park districts, anywhere local, food pantries, churches, that kind of thing. A lot of organizations serve specific populations, such as organizations that help people with disabilities or veterans or the elderly or people with certain diseases. So consider those organizations as well. A great way to start is to volunteer with an organization that interests you or inspires you, and seeing if there might be potential projects or work that could be done by an intern, and asking if you can help with that, if they will sponsor you for your internship. We've had many students set up their own internships just simply by knowing the right people and asking for a sponsorship for an internship. The other way you can look locally is to consider your employer as a potential internship sponsor. To do a workplace internship, you'll have to set up projects and activities for internship that are outside of your normal day-to-day tasks and routines. For example, if you do something in health management, then your internship will need to be something completely different, such as program development or research or outreach or that kind of a thing. As long as it's different than what you do as part of your regular job, a workplace internship should be approved. You'll also need to make sure that you have the hours set up to do your internship. Some sites are very lax in when you can work on internship activities. So they might say you can do internship, 2 days out of 5 days while you're working. Others might say you can only do internship when you're not on duty. So it's really up to you to work with your site and your employer on what's the best for you, as long as you're making sure that you can gain 240 hours in the time period for your internship. If you want to start looking globally for internship opportunities, you can look online. www.internships.com is the Chegg internship website. That might be helpful. Other helpful sites might include Indeed or some government sites that offer internships and fellowships for public health students. You can also just broadly look at different websites for different organizations and seeing if they're hiring and if they're specifically looking for interns. Networking with your colleagues, with your physicians and nurses in your area, with people who work in public health research. Anything that you can do to get a foot in the door with an organization is going to help you in the long run. We do not limit where you can do your internship. We just have to make sure that the internship is purely focused on public health, and that if it is a workplace internship, that it is separate from your job. To be eligible for the internship course, you have to complete Community Health Analysis, which is PBHL 6898. We also recommend that you do your 3 electives prior to starting your internship. If you are a dual degree student, you'll want to make sure you do your management courses before you start your internship if you can. We don't require that, but we highly recommend it, especially if you're looking for an internship in health management, because the management courses will help you. If you find an internship after you've completed 6898, but before you've done your electives or management courses, that's okay. You'll still be eligible for internship. We just recommend that you make the internship your final course if possible. The other part of the process is you'll need to fill out some paperwork prior to the start of your internship. Once you have an internship site secured, that paperwork will be reviewed by faculty, and once they approve you for internship, you'll be registered for the next term. Usually the paperwork is due about 3 or 4 weeks before the start of the term, so if you have any delays, you'll need to communicate that with your internship coordinator, and we'll make sure that you can get into the course, into the term that you desire. For your preceptor, you have to make sure that you have a supervisor or mentor at the site to serve as your preceptor. They have to have some sort of a master's degree or higher. It doesn't need to be an MPH. It could be an MSW, MBA, MS, but whatever it is, it just has to be above a bachelor's degree. The preceptor might be assigned to you by a site, or you might self-select them. For instance, if you know somebody who is able to bring you on as an intern at their organization and they agree to be your preceptor, that is okay. They just have to be qualified. Your preceptor will sign off on your time logs and your evaluation, so you need to make sure that this is someone you can be in regular contact with. Okay, so to get started, you'll need to find an internship. You should start looking at least 2 to 3 months before your desired term. For example, if you want to start interning in January, you should start looking for an internship in September or October beforehand. And again, searching locally, online, making those network connections. Some sites may require a lengthy application process, while others might just, ask you to go to their website, fill out some things, and then they'll call you and say you're hired. So it really depends on the site. At the very least, you should prepare your resume and a cover letter that is tailored to that organization and that internship. And then you will need to follow up after you submit your application. So for example, if you just go to a random website and apply for their internship and you don't hear back from them in a week or so, follow up with an email to a specific person or even a phone call to a specific person at that organization, and just let them know that you're very interested, confirm that they received your application, and find out if there's a timeline from when they'll let you know whether you're a viable applicant or not. And you'll need to make sure that you understand the processes for that site as you apply. Every site is different. Every site has a different process. So don't assume that if you did something for one organization that applies to all organizations. Lastly, be aware of any scams or potential phishing offers. A lot of times you'll get emails that say part-time internship, thousands of dollars. Those are usually not legitimate. Most internships are not going to be paid, and very rarely will a site, give you an amount that they're going to pay you. So if you see anything that looks too good to be true, it most likely is. We're happy to vet that for you. You can always forward that information, but you can, with a little Googling, you could probably figure out if something is a scam or not. Usually if you get like a blanket notification and email about an internship, it's probably a scam. If you hear from Benedictine about an internship, we have vetted that, and you should be confident that organization is legitimate. Okay, so you'll have some documents that you'll need to fill out. The most important of that is an internship plan, and we provide you with that template. You'll need to follow those directions to the letter because that is what the faculty will use to determine if you are eligible to do that internship or not. So there are some videos associated with the internship plan that you should check out. One of them is just kind of a quick tips on how to fill out the plan from more of a technical standpoint, and the other is a very in-depth video about what the plan should contain in terms of what kinds of activities you should be listing, what kind of work products you should be thinking about, that kind of thing. So in general, you will work with your preceptor to develop the internship plan, and once a final plan is in place, you'll be submitting that for review. You'll also need to submit your resume and your preceptor's resume to us for review. The sooner you get that paperwork in, the more likely you are to find out if you've got that internship for the next term, that you can be enrolled in the internship class. So the number one tip for success is get your paperwork in on time or even early. The other tip we can provide you is to utilize the resources in your community to find the internship that you want. One of the reasons that we do not find students internships is we don't know you, and we don't know your passions and your interests and your backgrounds as well as you do. So it's up to you to find an internship that meets with your not only history of experience, but also your future career goals. If you're interested in a career in health management, then looking for health management internships is going to serve you well. Having us find something for you that may or may not work for you is not going to help you in the long run. So really utilize your resources, step out of your comfort zone if you need to, knock on doors, make phone calls, send emails, check out websites. Looking for an internship is time consuming for a reason, because you are setting up your next step, and it should not be something that just falls into your lap. So take the time to really find an appropriate internship for you. Okay. The next step for success is to review the internship resource page on Engage and learn as much as you can about the expectations of the paperwork, the deadlines, and also to review the different sites and get some brainstorming ideas for where you can look for your internship. You can download all of your required documents from that site, and you can also, once you review the documents, ask questions. So, for example, a lot of students might have questions about the affiliation agreement that needs to be signed by the site that you'll be interning at. And so if you give yourself enough time after you've downloaded and reviewed all of those documents to ask those questions, we can provide you with the answers well in advance of when all of that paperwork would be due. Definitely, without a doubt, get to know your organization before you start the internship plan, even before you agree to do the internship. You may apply at 5 different places, and as you're going through the search processes, all of the sites kind of start to sound the same, and all of the internship activities start to sound the same. And then when you finally get that offer, you're excited about it, but it may not be what you remember. So make sure you understand exactly what the site does and what they expect their internship to do. And you should know who your preceptor is so you can start working with them to develop your internship plan well before the deadline. Your preceptor should not be filling out your internship plan. You'll need to do that. And in order to do that, you'll need to understand who the organization is, what activities you'll be doing, and what your goals for that internship are. And then you'll need to provide the documents to your site and your preceptor in advance of the deadlines as well. For example, if your deadline is October 15th to get your paperwork to us, you can't wait until October 10th to submit the paperwork to your site. You'll need to submit that paperwork to them October 1st and tell them it's due October 10th. And that will give you a little extra time to follow up with them because they are busy, and the sooner you provide the information to them, the faster you'll get it back and the less stressed you'll be when the deadline date looms. So if you follow these tips for success, you should have a pretty good shot of finding an internship that suits your needs. You'll have a really good shot of getting your internship documentation done in advance of deadlines, and then your internship documentation will be reviewed, and you'll know if you're approved for internship well in advance of the start of the term. So as we mentioned, the internship plan is the most important document that you'll submit. There's also a short application form that you can download from the site, and that goes to the internship coordinator. There's also something that's called an affiliation agreement. What you'll download on the site is the standard agreement, and you just need to provide that from your site. Anyone from your site who's authorized to sign the agreement can sign. It can be your preceptor, it could be a site manager or site coordinator. As long as someone who's authorized to sign that document signs it, they just need to fill out the top of page 1 and fill out the signature page on page 6 and return it to us. You can turn that in whenever it gets done. You don't have to wait for the internship plan to be done before you turn that in. Sometimes a site will ask to make changes to that standard agreement, and sometimes they'll have their own agreement. If either of those are the case with your organization, you'll need to contact Mary Spangler with the site's name and contact information, and she will work with them on getting the paperwork done for that site. It will not hold up your internship, so if you're still working on your internship plan, you don't need for the agreement to be done before you submit the plan. However, if you wait until after you've submitted your plan and we're still waiting to hear from you about the affiliation agreement, and you tell us, well, they wanted something special, but we don't know about it, that could hold up your internship. So you need to make sure that if your site wants us to fill out a special document, or they have their own document, or whatever the case is, that you tell us right away. We'll also need your preceptor's resume. If your preceptor only has a bachelor's degree, that's okay. But someone else at the site who has a master's degree needs to sign on as a co-preceptor. They don't need to be in charge of your day-to-day internship tasks, but they do need to sign off on the internship plan. So you will need to add their name as co-preceptor to your internship plan, and you'll need to provide that person's resume. Again, the co-preceptor does not have to have an MPH. They can have any master's or doctoral degree, but they need to be aware that you'll be interning there under their name. And then your regular preceptor who has only the bachelor's can be your immediate supervisor. You'll also need to provide us a copy of your current resume. Since you're applying to probably more than one internship site, you'll probably have a current resume, so that should not be a problem for you. And then, as we said, the deadline is typically 3 to 4 weeks before the start of the term. Sometimes it does take a little while to get the internship documents turned in. Just let us know, and we can provide you with alternate dates. But if we don't know about it, we will hound you, and that could delay the start of your internship. If you need help developing your resume, or you need help searching for an appropriate internship, or you just overall are thinking about, future career opportunities, we recommend that you contact the Career Support Center at Benedictine. You can do that by contacting Mr. Lee Cruz at the email address lcruz@ben.edu, and you can go to the website that's listed on the screen. They are a really, really helpful group of individuals whose sole purpose is to help you set up your internship or your career with the best foot forward. So if you need help with mock interviews, if you need help with crafting cover letters, they are more than happy to support you with that. And we've had many students who have worked with that career office come out stronger for it, and they would say that it was a helpful experience. That's the end of our presentation. Thank you for staying with us. And if you have any questions, please contact Cara or Mary, and we will get back to you with your specific concerns. So thank you so much, and good luck with your internship search.
Okay, so thank you all for sticking with us throughout the presentations that we had this evening. If you'll give me just one moment, I will get the poll for you guys to fill out regarding the interest in the opportunities mentioned this evening. I hope that tonight was helpful for you all. I know that it was very, very helpful for me. Just to hear about the different tips that they have for students regarding finding different opportunities. So right. So I have entered the poll into our chat right now. I just saw that Liz had mentioned if we could share LinkedIn profiles with each other after this. I would love that. That's a very, very great idea. We should all stay connected. Definitely, because we're probably going to be working with each other in the near future. So probably after this, we could, like Liz just mentioned, we could probably just have a document that we share. That would be helpful to kind of share information with each other. So I've got everyone's name, so it looks like we're all set there. But yeah, that concludes our evening. Once you guys fill out the poll, thank you so much again for being with us. We truly, truly appreciate it. And we are looking forward to day 4 tomorrow, where we will be talking about moving forward and advancing equity in public health. Thank you guys.